I feel disappointed, but I also feel like there's a lot of room for improvement because the score is so low. I think that there are already several programs going on within the community where it relates to the built environment, with the extra bike lanes that have been put in downtown. When I see new road construction, it always comes along with sidewalks, so I know that there's going to be additional transportation walking. The use of the Monon Trail can be improved, and I think that with better lighting and better traffic on the Monon Trail, that it could be improved there. And I think in our inner city communities that the park areas and the recreational areas there are getting some attention. So this is a snapshot of what's going on in Indy right now, but when we look at the way Indianapolis is being developed for the future, I'm encouraged. I think that where Indianapolis hurts is in the area of public transportation. And when you look at communities that, like if you look at Washington, D.C. that was #1, and you look at their public transportation, we can see that people are more physically active because they have to walk to the central location for public transportation, and then they have to walk to wherever their destination is after they get off of the public transportation. And I think if we had something like that in Indianapolis, it would reduce the traffic, but it would also increase the physical activity. On a campus like IUPUI or even downtown, parking is such an issue. And so if there is an opportunity for us to get to some place where we could take public transportation in and then walk all day long, just by default, our physical activity would be enhanced. If you've lived in DC, you know that there's a really large inner city community and underserved population. And so when we look at the research, you know that those are the groups that are least likely to be physically active, and that is the highest population in Washington, D.C., and Washington, D.C. still got #1. So that lets you know alone that regardless of your socioeconomic status, regardless of your, what's the word I'm looking for, of your deliberate physical activity. So we think of physically active people, we think of people who deliberately go out and walk and deliberately go out and exercise. And this population has been shown not to deliberately participate in physical activity. And it is the highest population in Washington, D.C., and it's still #1. And I have to look at that as it's because of the public transportation. And these people are using public transportation and they're forced to walk, and so they're more physically active. Well, I think it's a way to cut down on health disparities while providing an opportunity for people to go from place to place. I think that public transportation and walking trails, complete sidewalks are important, and that's what Indianapolis needs, but I also see that Indianapolis is going in that direction.